Welcome, American Sentinel students. My name is Nicole McCoy. I am the Virtual Campus Life Director here at Post University, and I'm excited to talk to you today about time management for healthcare workers. Time management is the process of planning, organizing, and prioritizing how you allocate your time to specific tasks. In the fast-paced world of healthcare, characterized by busy days, tight schedules, and reductions in staff and resources, time management can often feel like a challenge. With the right strategies, it is possible to stay focused on what matters most, enabling you to provide high quality patient care while maintaining your personal well being. In today's society, we increasingly rely on digital tools and systems to help us enhance operations and efficiency. By leveraging the use of digital tools, healthcare professionals can manage their tasks more effectively, reduce administrative time, and ultimately focus more on patient care. Consider tools like Nuance Dragon Medical One to dictate patient notes, Calendly to simplify appointment scheduling, and apps like Time Hero to help prioritize tasks. If you find yourself constantly switching between different types of tasks, you might find it drains your energy quickly. Set aside a block of time each day for completing certain tasks, such as returning phone calls and responding to emails. Or try using the Eisenhower matrix to learn how to batch tasks into urgent versus non urgent categories. Dedicate a few minutes at the beginning of your shift to get yourself and your workspace organized, creating a to-do list for your day or shift. This will help you to stay on top of what is next, reducing stress and allowing for a smooth transition from one task to the next. Create a schedule that works for you. Whether you use your mobile device, a digital calendar, or an old school planner, you can color code and block off time for meeting with patients, responding to emails, attending meetings, and making time for classes. It's all about finding a system that works for your needs and position. Set realistic goals and then break it down. Clarify your goals, making them more achievable. What are the top 3 critical tasks for your day? Structure your day using smart prioritization. Make sure that your goals are specific, measurable, achievable, or relevant, and time bound. Clear communication can significantly improve time management and prevent errors. Hold brief daily or weekly huddles with your team to review important cases or set priorities. Use a handover system to ensure a smooth changeover from one shift to the next. Be clear and direct in your interactions with patients, colleagues, and support staff. This will reduce the chance for misunderstandings and lost time. Identify routine tasks that could be handed off to administrative staff, like patient reminders or data entry. Remember, asking for help isn't a sign of weakness, it's a strength. Time management isn't just about efficiency. It's also about ensuring you're physically and mentally healthy enough to perform at your best. Set quarterly goals for yourself, whether it's completing a certification course or making time to schedule your own wellness appointments. Take regular breaks, even on busy days. Step away, even if only for a short bathroom or snack break to recharge. Be accessible, but set healthy boundaries. Limit after hours communications, especially those that are non urgent. Remember, setting clear boundaries allows you to recharge and return to work refreshed, leading to better outcomes for you and your patients. Remember, time management skills help you maintain a healthier work-life balance, reducing stress and improving patient care.